Is Meredith going to join?
I hadn't heard otherwise, so she'll probably be along shortly.
Can you hear me?
Yes.
Okay.
All right, there's Meredith.
Okay, it's just turned 3 o'clock. I'd like to, good afternoon, everybody. Call this Board of Health meeting to order. This is the Thursday, August 20th, 2020 Board of Health meeting. Just like to remind everybody that this meeting is being recorded by audio and visual. And pursuant to Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click raise hand button if they wish to speak. The chair will call on those who have raised their hands in order that they were raised. If you now have an audio capable device, the Q&A button can be used to take a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. All questions should be directed through the chair. For attendance purposes, can you acknowledge that you are present as I call you? James Cooper.
Present.
Melissa Murphy.
Here.
Meredith Lefrey. She's muted, but she is here. Malcolm's not on.
I'm here.
Okay, gotcha.
I have to figure out how to get my camera on, but I'm here and listening and seeing everybody else.
James Cooper.
Here.
Okay. We also have Roberto, and we also have Cartel Crowley, our assistant director, on.
They're here. And Art just said here, but he's muted.
Yeah, he's here. Okay, thanks. So, Roberto, do we have any public comment that's questions coming in that's not on the agenda that anybody would like to bring up?
As far as the attendees go, we have Marion Henry here for the VEITH, the Three Gladland application. Bill Greeter, are you here for public comment? If you have one, go ahead and raise your hand. And then I believe Steve Cohen is here for one of the others. I don't know if it's North Cambridge or 9 Beach. Oh, 7 Mile. He just texted me. So he's here with the 4-7 Mile Lane with Arcus Sparrow. But so far we have nothing on public comment.
Well, we'll go right into director's report.
So we are doing well as far as it's been COVID all day, all the time. And we're slowly coming out on the back end at the end of summer. And one of the things that is going pretty well is we've been able to keep the cases low. We're going to see one more today. So we're going to hit 50 cases in total. This one is a person who caught it locally. So we're going to be really focusing our contact tracing for this one. Other than that, our staff has been doing all our inspections and keeping up with all the food inspections. And we brought in Madison Humphrey, who was our COVID-19 officer, who is now going to be the seasonal night inspector as well for the rest of the season here. And we're going to have her trained on as much as we can so that she can chip in on everything else here too. Other than that, I think we're good. Steve, I think you're muted.
Any questions for Roberto from the board? Melissa?
Thanks. I had to find my unmute button. Roberto, I think I asked this question, a similar question last night at the select board meeting, but I just thought we should talk about it maybe again as a group. I understand that the earlier restaurant closings are helpful in our effort. Have you heard any feedback on that from the community or restaurant owners? And just, I think, a general sense of how that's working in terms of our COVID prevention. Thank you.
So yes, thank you. So as far as the feedback for that goes, we've been hearing a lot of good things, actually. Some of the restaurants have actually been planning on doing it themselves anyway, so it kind of puts everyone on a level playing field. We've also heard, the occasional some of the backlash of, I make a lot of my money in those last hour and a half of the day. So we do hear a lot of back and forth here, but oddly enough, there was an article in NPR today where they're talking about how bars are fueling COVID outbreaks in other states. So we kind of, once again, Nantucket is just ahead of the curve.
Any other questions? Seeing none, well, I guess we'll move on. That the election of officers has already been done, so we'll scratch that. Review of the minutes from July 16th, July 30th, and August 7th. Does anybody have any comments, questions, revisions? Seeing none, can I get a motion to approve those 3 dates of the minutes?
So moved.
I'll second.
Okay. All in favor by roll call vote. Melissa Murphy.
Aye.
Malcolm McNabb.
Aye.
James Cooper.
Aye.
Meredith Lepre.
Aye.
And Steve Visco says aye. Okay. First, increase loan at Brannigan, 5 Fishers Landing.
Yes. So this is a loan that we had already accepted before. In the original estimate that was put in, the replacement of the tank was not there. It was originally thought that this was going to be fine, but as more of the engineering and everything went through, they realized they need to replace. So we need to up the loan just to get the work done.
Any questions on 5 Fishers?
Nope.
Okay, can I get a motion to approve the extra funding for the loan?
So moved.
Oh, second.
Okay, all in favor by roll call. Melissa Murphy,
Aye.
James Cooper,
Aye.
Meredith Lepre,
Aye.
Malcolm McNabb,
Yes.
and Chair Steve Visco says yes. That is approved. Okay, next on the agenda, variance for 3 Gladlands, well protection zone, section 62.03C local bylaw.
Yes. So let me allow Marianne Hanley to join in. So as she's representing, Marianne, can you hear us?
Yeah, I can hear you.
Okay, perfect. I also have the application and the drawing available here if you need me to share my screen. So just let me know. But otherwise, Marianne, you have the floor.
Yeah, I'm representing Tim and Jill Veith, who are buying a piece of property on 3 Gladlands Avenue, and they are planning to create a covenant lot for an acquaintance of theirs. And in order to do that, we need to install a separate septic system and a separate well. And because of the configuration of the lot and the surrounding wells and septics, we need a variance from section 6203C, because there's 2 small areas that are about 3 feet each on either side of the well protection zone. Well, we can't meet the full width that's required. I actually, Dick Earl did the plan, and you have it, hopefully you've seen it. And Dick is sitting here with me if you have any technical questions about how he drew the plan or established the parameters for the well protection area.
Okay. I don't believe there's any staff comments on this. Art, do you have any comment?
Yeah. We'll have Art. Go ahead, Art.
Don't forget to unmute yourself.
How about now? You can hear me now?
Yes, sir.
All right. This is a very important request that they're making. Just bear with me for a few minutes. I kind of want to give some background information. A quick overview of Local Board Regulation 62. It was created in 1990 to address proper construction of wells, provide setbacks to sources of contamination. It does set testing parameters and also abutter notifications. Prior to 1990, all we used was Title V for a setback between a well and septic. So this regulation affects all properties on island. So if the lot was created before 1990, it's maximum feasible compliance. So if you can only meet 275 feet, and that's the best you can do, well, that's the best you can do. Lots created after 1990 have to comply. All right, so and just a quick explanation on the 300-foot down gradient. I think you all get it, but I just want to, do a quick tutorial on that. When you apply for a well, the proposed plan indicates groundwater direction. Okay, the plan must show the 300-foot by 100-foot well arc, which you should be seeing on the documents that you were provided. There can't be any septic systems or other potential sources of contamination up gradient of that well. Okay, obviously the concern is groundwater flows in the direction possibly bringing contaminants to a drinking water well. So that was the point. Another quick side note: 2017, the Health Department, Board of Health, approved local regulation 78. It's another well reg designed to protect drinking water, mandating testing so that we had a little achieved early detection of any problems there. Roberto did a very nice, very informative memorandum that's online regarding the need to do that regulation, and septic system effluent and nitrogen is part of the reasoning for that. That said, in general, private wells here on Nantucket are fairly shallow. In the big picture of off island, probably somewhere between 40 to 100 feet in depth. Our soil conditions, being sand, allow for contaminants to travel further and faster than they would in a more restricted soil. So the Board of Health in 1990 had a lot of foresight when they developed the 300-foot down gradient section of this regulation. There's other things in this regulation that are very good too. But two important things that it does, it protects the aquifer by controlling density and protects drinking water wells from potential sources of contamination with reasonable setbacks. It's very effective. It's a very effective regulation for areas that are served by well and septic, and minimizes the potential sources of contamination that would be upgrading of those wells. So this variance is, they're going to create a vacant lot. Obviously 30 years after the regulation was in effect. There should be, I'm not telling you that there is in other state regulations, there really should be a high standard to be granting this variance, a very high standard, such as, the property would be unusable. That's generally what Title V says in granting a variance in a situation like this, which the property is not unusable. obviously has structures on it now, and they could do a garage and probably add a second dwelling. You know, so I don't see any compelling reason to allow this. You know, the other issue is if the variance is granted, got a lot of concerns with how this board's going to deny anybody in the future. I mean, I don't want to be a wise guy or be flip, but it'd be almost like, because there is no compelling reason, the regulation would be useless going forward. I just don't see how the board could tell anybody differently. So, you know, I only see future detrimental environmental impact if it is granted. The proposal does not comply, and the request, I believe, should be denied. And whether it's 3 feet, 2 feet, 8 feet, you know, it does not comply. And if you got any questions, I'd be more than happy to answer.
Thanks, Art. Any questions for Stella? Jim?
Is there any way that they can reconfigure the lot that they want to make everything work?
I suspect that's a question for Dick, and I'm guessing if they could do it, they would do it.
Okay, thank you.
Meredith?
So is it that they want to put a second well? I'm just making sure I understand. I didn't know if you could put the map up to.
So they're trying to create a second lot. They're trying to subdivide, make a second lot, and the well that they're putting on that lot cannot comply with this regulation in the 300-foot down gradient requirement.
Okay.
Art, let me put up the map here. Does everyone see this now?
Yeah.
Okay. So Art, do you mind helping me point this out here?
Yep.
And so if I'm not mistaken, this is the well here. And then this proposed septic system is here, and this will be the lot line here. In order to allow for a new lot to be created, there has to be its independent drinking water source on each individual lot in order for that to be viable. Marianne, do you have some insight on this?
So can I?
Oh, yeah. Sorry.
So
Go ahead, Art.
if you look up gradient, there's 2 septic systems on both sides, right on the lines there and on the other side, that are within the 300-foot down gradient. They're only about 120 feet from the well. Probably Dick could answer that better.
Yeah.
You know, so
Yeah. Dick, can you?
what's the, you know, anyway.
Okay, first of all, as I said, the reason that we're trying to do this is we are trying to create a covenant housing lot for a year-round resident. Dick can talk to you, but I know he's looked at this plan backwards and forwards, and because of the shape of the lot, it's not a square rectangular lot, it's a long lot with a curve that goes around the bend of the road. This was the only way that he could fit in what's required for a separate lot for a year-round owner is a septic system and a well on each of the lots. So Dick, can you supplement that at all or answer the questions that Artel has?
Yeah, this was the best location that we could come up with for the proposed well. After studying the HWH maps and moving things around as much as we could, we were very tightly constrained by the septic systems and the well protection zone. And this was the very best we could do.
I would just say, I'll comment on that. I mean, the only way for you to get this to comply in reality is to ask those neighbors to move their septics, which they have the room either side to move the septics. I mean, it's going to be hard. You know, right now you don't comply and you're asking us to create a lot that's detrimental to the environment. And I just don't see Did you actually go to the neighbor and dig up that one leach pit on the left? And, you know, it's probably way pre-95. Nobody set up instruments hardly back then. The house was there, probably tape surveyed it. Is it exactly where it is supposed to be? And you just have a cube on the other one. That it's the detail. I mean, you couldn't make up the 3 feet, or is it truly how it is?
We're putting them on and showing them exactly as they show on the record plans on file, the as-bills.
Okay, does anybody else have any other questions? And I mean, any lot in Nantucket with its covenant rule, any lot in Nantucket can be covenanted. Doesn't matter where it is on the island. But when you do, it's like creating a subdivision. The lot has to comply, especially if it has well and septic. If you're on town water, where you can definitely make things a lot easier.
Yes. I'm seeing Melissa had a question.
Hey, thank you. Steve, as a newer member, I really defer to you and Jim and Malcolm for your expertise on this, but as a lay person, it's hard for me to understand how 3 feet, in my mind, 3 feet seems negligible. Can you help me reconcile why 3 feet is that critically important?
Oh, I would, let me refer to Art to explain. And it's specifically to do with the enactment regulation in 1990.
So, you know, I'm just thinking of being on the other side of this. If you granted this, the arguments I could make so that, you know, almost anything would be, you'd almost have to approve. So look up to because you're going to maybe say you're going to say, oh, we'll give 3 feet on the side. Well, would you be willing to give 3 feet at the top? So 297 is good enough. So these are only 140. So if it was in the middle, would that be good enough? You know, I mean, these regulations are set. That's the standard. Once you start waving out of that standard, is 3.5 okay? Is 4? Is 5? Where's your squeal point?
Yeah, this is Malcolm. I can't raise my hand because for some reason my camera's not working. But I mean, we've dealt with this many times before. We've had requests to vary inches at times. But as Art said, sometimes, well, next time 4 feet, well, you gave 3 feet last time, so now 4 feet's all right. It starts getting slippery. And I think the history of this board is we've been pretty strict about the regulations, so we don't end up slipping. We had a big argument about inches once, and we stayed to the regulation.
I mean, I would agree with exactly what he said. We've had situations where people wanted to put an addition on and not move a tank, but they could move the tank and comply. And we've said, well, if you can comply, you can move the tank. So, I mean, you know, the only way this lot is going to comply is if we give this variance. And then by giving this variance, I feel environmentally, you might as well just say, you know, this regulation 62 and flush it down the toilet. Jim?
The regulation is there for a reason. And if we do it once, everybody knows what's going to happen. There'll be everybody and their brother in here and say, you did it for this guy, you need to do it for me. So I'm against it.
Rather than, I think I see where this might be going. Rather than taking a vote today, is it possible that we can continue this and maybe we can check with the neighbors to see if we could do anything to physically locate their systems on the ground? Because as you said, the plans that were filed are old. And I don't know if they will. They may just look at us and say, no, absolutely not. But I think it's worth a shot because, as I said, we've got a year-rounder who's, trying to move into this house that's already there on the lot. And if we can accommodate that, we'd like to do that. So with your permission, could we continue this matter till your next meeting? Or we might have more information, or we might not.
I would have no problem with that.
I have no problem with that. We've done that before.
Right. You could come back.
Thank you.
Do I need a motion to the fact to continue this to the next meeting?
I move that we continue this issue to the next meeting.
I'll
Second.
say,
Okay, by roll call vote. Meredith Lepre,
Yes.
Melissa Murphy,
Aye.
James Cooper,
yes.
Malcolm McNabb,
Yes.
and Steve Isco says yes. So we'll continue to next month's regularly scheduled meeting to give these guys time to definitely,
When is? Do you know when the date of that meeting is?
October.
it'll be the third Thursday, whatever that
Of
is.
October. I mean September.
September, yeah.
Sorry, September.
Great. Thank you very much. I appreciate your help.
Okay, thank you.
Okay.
Okay. Next on the agenda, 14 North Cambridge.
Yes. So let me open that one up real quick. And this application, Art, are you available to connect on this one? Yes.
So this is a failed septic system in Nantucket. They're going to repair it. I believe the only relief he's looking for is to the wetland coastal dune salt marsh, which this would be maximum feasible compliance. This is an existing home with a failed septic, and it will be innovative alternative. And the relief he needs is local 100-foot setback to the wetland, which, is we would normally grant. So we would recommend granting it and getting this thing repaired and back in order, protecting groundwater.
Any questions for Art? Okay, seeing none, okay, a motion to approve the variance.
So moved.
Okay, second.
Second.
Okay, by roll call vote, James Cooper,
Yes.
Melissa Murphy.
Aye.
Malcolm McNabb,
Yes.
Meredith Lepre,
Yes.
and Steve Isco says yes. Variance is approved for 14 North Cambridge. Next, we have variance for 9 Beach Street.
Okay. 59 Beach Street. The representative is Paul Santos. I'm Paul. If you want to mute yourself, you should be good to go.
Okay, thank you.
Hey, Paul.
Are you there, Roberto?
Yes, sir. We can hear you.
Okay, thank you. Thank you for the last one. That application was mine too, so thank you to Art for taking care of that one. This is a similar request. This is out in Codfish Park. It's 9 Beach Street, in which the owner has an opportunity to take a small cottage that is on an abutting lot at 15 Beach Street and transferring it to their property. In order to do so, we have to take the system that is there now and just relocate it on the lot. That system that's out there now is within 100 feet of the coastal bank or coastal dune associated with Codfish Park on the opposite side of Codfish Park Road. So we're simply taking the system that's already there, not increasing the size. It's a 3-bedroom system. It will continue to be a 3-bedroom system, and just moving it onto the parcel. In doing so, though, we're still within 100 feet of the coastal resource, which we can't get away from. And we need relief similar to that last application for that. The application is also similar to the last one, has also been submitted to the Conservation Commission and asking for the same relief as it's needed from that board also. So happy to answer any questions that you may have. So what we're basically doing is relocating an existing 3-bedroom system on the lot. It is a pre-95 system, so it will be relocated and upgraded to the current code. And happy to answer any questions that you may have.
Any questions for Paul? It's not, seeing none, could I get a motion to approve 9 Beach Street's variance?
So moved.
Take a second.
Second.
Favored by roll call, Malcolm McNabb,
Yes.
James Cooper,
Yes.
Melissa Murphy,
Aye.
Meredith Lepre,
Yes.
and Steve Visco says yes. That's all.
Thank you very much.
Thank you, Paul.
Yay, variance 4 7 Mile Lane.
Yes, so the representative for 7 Mile Lane is here, Stephen Cohen. Steve, you have the floor. Steve Cohen.
It's just to unmute.
Am I unmuted?
There
We
you go.
got you.
Okay, great.
Yes, Stephen, you're good.
Okay. So this is an application for an upgrade of the system from 2 bedrooms to 3 bedrooms using an IA system. Because it's in the wellhead recharge district, the variance is required. As I think the board knows, the IA system for a 3-bedroom actually has less nitrogen than a conventional 2-bedroom system. So even though it's a 20,000 square foot lot, this would be an improvement than what they could do by right.
Do you want to, Art, go ahead.
Yeah, basically they're asking for a bedroom credit. Property's going to be on town lot. Within the wellhead protection, so the board wants, you all make that decision. It's something you've done repeatedly in our wellhead protection in town here. It's something that has just pretty much been a standard. You granted it because it's a net benefit to the environment. And so, we certainly would be in favor of it as well.
Does anybody have any questions for Art? No?
I'll make a motion to approve it.
Okay, can I get a second?
Second.
Okay, all in favor by roll call vote. James Cooper,
Yes.
Malcolm McNabb,
Yes.
Melissa Murphy,
Aye.
Meredith Lepre,
Yes.
and Steve Visco says yes. Thanks, Steve.
Thank you, everybody.
Okay, board member updates and concerns. Anybody have any? Go ahead, Jim.
I'd like to talk about the wells on the island. I know we said we were going to start having people every 2 years or whatever it was to have their wells checked. Are we still on board for that, or where are we with that?
Yeah, we're definitely on board to do that. The only issue is COVID kind of messed all that up. So it's been a little bit more difficult this year. It's kind of taken precedent. We were going to be reaching out to all of the property owners and caretaker groups that we had, so that we can ask caretakers to start reaching out to their property owners as well. And there was this whole outreach plan that was getting set up this winter, and that got derailed. So unfortunately, this summer that fell off. So what we're going to do is just going to push that back to this coming fall and winter to do that outreach again. And unfortunately, with it being the odd year, we're going to miss 1 year's worth of data. We are still catching all of the well tests that come in through Barnstable. And honestly, with the information that's coming out about PFAS out there. There's been a renewed interest in water testing for wells, even if they're not near any of the source of contamination. So we do get all of those, and we're going to be looking into creating a new report on that, just like we did last year. But unfortunately, yes, we did fall behind on the outreach and education for the well testing, but we are looking forward to getting that up and running again.
I'd like to make a suggestion, Roberto. How could we think along the lines of maybe having the well checked with the property transfers?
A lot of property transfers already do that. So we do capture those, everyone that uses through Barnstable, but absolutely, we can definitely alter the regulation to do that in order to have it for every property transfer.
And maybe that takes some of the pressure off us for getting everybody to do it.
It really does. No, that's definitely something we can look into. And
Okay.
I can see if we can get town council to look at that to make sure that we're still good with that.
Okay, thank you.
Have we seen an increase in just more testing because people are just more aware of it now?
Yes, definitely. Poor Anne has been hammering out all of the, I'm looking out the window here because I can see Anne. Poor Anne has been handling all of the water tests on Tuesday mornings. We get pretty slammed. Usually it was one cooler a day, a week that would get sent out, and even then it was one of the smaller coolers. We've been pulling out some of the big coolers and sending 2, sometimes 3 of those every Tuesday. So what's really good is that Barnstable County has been really great at getting us our water bottles and our sample kits. So they've been supplying us. So we're still in good shape there. It's just surprising.
Do those tests, that doesn't test for PFAS though, does it?
No, it does not. It's the typical drinking water test just to meet the normal state drinking water standards. The PFAS tests are incredibly expensive and require a GC mass spec. For some reason it's I'm blanking on what GC is, but mass spectrophotometry. And what that is, the Barnstable County Laboratory just doesn't have that equipment available. So they're going to be pushing that out. All of that is outsourced to other companies. As far as a list of corporations that do that, you can find it on the PFAS website that the town has put up. I will have to look up to confirm that website exactly.
Mr. Chairman?
Yeah, go ahead, Mike.
Sorry, I can't raise my hand. I have to figure this glitch out. But last time, in relation to Regulation 51, I thought we were going to discuss forgiveness, extending the 10 years to perhaps longer at some point. I thought that was going to be on this agenda.
If that was going to be on this agenda, that's my mistake for not putting it on here. I can put it on for this upcoming meeting. That's my.
I mean, we could. I don't know if we need just discussion on it, and then maybe a public hearing if we go that way. But I think we owe it to this Nantucket residents to at least discuss it.
Yes.
Yeah.
And I believe Mr. Greeter is here for that. He has his hand raised for that specific reason, I believe. You want me to put?
Yeah, go ahead. Have him put him on. Yeah.
Bill, I think you're up.
Did I successfully unmute myself?
Yeah.
Yes, you're good.
Thank you for taking. I'm glad Malcolm brought this up. It dovetails in with 2 of the policies that you're currently dealing with on the previous applications, 62 and 52. We now have almost 500 members in our association, which obviously includes a bunch of residences out in Nantucket. And ever since the Board of Health has started to improve and tighten the regs on septics and wells, we've been pushing that information out in our newsletters. And we're getting ready to do another one shortly. And what we keep running into is an issue of updated information available to the public. And I know this particular spring and summer has been trying, and as far as trying to get stuff done, but some of this has been going on for some time. And currently, the regs 51, 52, and 62 don't have the latest and greatest Board of Health regs. They're in the private well testing. I mean, the private well policy, there's nothing in there about the testing. And we've been telling our members ever since you voted that in that they're supposed to be doing it. So we look pretty silly when we say that there's a regs there, and then we go to send them along and we can't produce online regs. So I'm bringing this up as a point of information, a point of frustration on the public's part. And is there a way that the Board of Health can request additional help, hours, task an intern, do the tax credit when it rolls back in for the senior citizen, something to provide relief to the staff to get these things up to date and available to the public?
Yes, I mean, I get where Bill's coming from, and to tell you the truth, you are understaffed, and I know you have those all probably in your desktop.
Yes.
And each time we do one of these public hearings, and then we do the regulation, they've been sent off to be rewritten. So I know, I get where he's coming from, and it would alleviate some of the frustration with people trying to find those up-to-date regulations on our website.
Yeah, the website falls squarely on me. So that's I will get the newly voted web stuff up. I will make that a priority. My apologies.
Thank you.
Thanks, Bill.
Yeah, after we voted in the last regulation, we had them proofread, and I got the final response back, and we just haven't put them up. So I have them, and they are in PDF form. I just have to put them up onto the website. That's all me. I can do that.
Okay, great. Any other concerns? Just to go back to what Malcolm was saying with 51, were we going to put that on the agenda and that's to potentially, increase that IA
the sewer connection variance.
So they, really should have a little more time than the current 10 years, if and when sewer heads out that way, or for any other part of the island.
Yeah, absolutely. We can put it on the September agenda as well. So just in recap, to put it on, the two things that are being carried over to the next agenda is Hanley's 3 Gladlands and this the regulation 51 variance, or the IA variance for connection.
Right.
Yeah, that's actually regulation 69, I believe.
Yeah, that affects not just Nantucket, but the whole island. Yeah.
Okay, so I'll put those two on for next month's agenda.
Melissa?
Thank you, Steve. Roberto, I thought it might be nice just to update this board on your conversations with the school administration, the school committee on COVID reopening plans, and also wondering if we should schedule a meeting and then cancel it if we don't need it, maybe even 2 weeks from now, just before school's opening, and see how we are end of summer, or I don't know. Maybe it's not necessary. Maybe everyone doesn't agree with that, but it feels like there's going to be a lot of life over this next 4 weeks before we meet again, and a placeholder meeting to see how we're doing post Labor Day and right before school starts may not be a bad plan. Thank you.
And absolutely. As far as scheduling a meeting, I'll leave that up to you as the board. But as with the reopening plans, we are going back and forth with Dr. Hallett, the superintendent, with the reopening plans and the information that they're providing me. I've been providing them some technical information as we get it, some suggestions for the reopening protocols. But one of the most important things for all of us, everyone in the public to understand is no plan is going to meet everyone's needs. And there is compromises that some people are going to be unhappy about and some people are going to be really happy about that we're all going to have to look into. So it's just, COVID is something that's so new and so destructive and so disruptive that it feels like we're making it up as we go, because unfortunately we are. The United States hasn't seen anything like this with the modern technology that we have. So as far as finding a I wouldn't say a happy medium, but finding a agreeable medium with the hybrid opening, everything from remote learning through to in-person is where we have to stand. So I don't exactly know where everything is with this right now. I know the school committee voted on the plan as is last week, but I don't know where it goes from there. And then as far as another meeting scheduled between now and 2 weeks from now, I'll leave that up to the board. The only thing that I'm curious about with that is there isn't any votes that we can take as the Board of Health that can override the school committee's votes. So I'm just curious as to what what the end game is on that.
Melissa?
Thank you. Yeah, no, for me, it would be maybe less focused just on the school, but just community-wide. How are we done in the past 2 weeks? It will be post Labor Day, which is technically the end of our tourist season. So is there any recap? And I, personally, and I don't know if the board agrees with this, I'd rather have something on the schedule in case we need it and cancel it if there's nothing to talk about, if there's no major changes or, no major policy decisions we need to consider. Or maybe there's some emergency orders that we should or could reconsider in those 2 weeks after the season. So it's just a suggestion rather than waiting and seeing and then on a Monday saying, hey, can we all meet on a Thursday? And then as far as the school topics, I think it's just good for this board to be updated as to what's happening and the advice. I've got some questions. I'm happy to save them for the school, but I think, what do we do if there's one student who goes in and is infected, and then we start to see community spread out of the school system? So those kinds of things, I think we should at least be aware of and be talking about.
Okay.
Meredith?
So on that note, Roberto, I got an update email today saying that it sounds like if there's an outbreak in a school, the state will have some mobile units available.
That's the first.
Maybe that may have gone out to school nurses ahead of everyone. I don't know. Yeah. But my other question is about with the health department and the new regulation that all students in the public schools get flu vaccines. I'm just wondering how you guys can work with the hospital to make sure that happens. I know that as the school nurses, there's been phone calls made to Briar Patch and speaking with the hospital, but seeing as much flu as I have seen in the last 2 years, and now it is a state regulation that they all have to have it. Do you have access to getting, and maybe this isn't, I'm just wondering if the Board of Health gets access to more flu vaccine if the town doesn't, the hospital doesn't have enough?
Unfortunately, no. The Board of Health, the health department doesn't have a nurse on staff. And if we did have a public health nurse, we would have a Y number and an N number that we can use to order, but we don't. And this is actually the first community that I've worked in Massachusetts that doesn't have a public health nurse. with our own vaccine supply. So it's unfortunate that we're not going to be able to order in any of those early batches that come out, because when I worked in Everett, yes, we actually did get first choice in flu vaccine. We would get flu delivered flu vaccine and other MMR and all these other types of vaccines delivered ahead of everyone else, because we dealt directly through the strategic national stockpile. So it's a little bit more difficult here without a public health nurse. So I can definitely be Gary, Shaw, and I are in constant communication over at the hospital, and we'll be working together to try to get as much flu vaccine available to the island as possible.
That's like 16 to 1,700 students, plus any students, in the private schools that want them, plus
Oh yeah, no.
Recommended for 6 months and older. And I'm just concerned that there's maybe not going to be enough since that just came out. And maybe the town needs to think about getting a public health nurse. It might be that our population has gotten to the point that we need to think about that.
Yeah, absolutely. Absolutely. And then, yes, we're probably not the only state that's looking at this regulation. So we're probably going to see flu vaccine shortages as well. It's just this is something that's so unprecedented that as the governors make these orders, and we find out at the same time as the public does when he makes his announcements, we watch the same press releases that he does, the same press conferences that are on the news as everyone else at the same time. We don't get our guidance documents until after he's made his announcement. So it's a little frustrating. And the two professional associations that I'm on the boards of have all sent their letters of frustration to the governor's office on that. So we're working on trying to get ahead of this.
Okay, getting back to Melissa's thing about having scheduling a meeting, not meaning that we may need to use it. So how does the rest of the board feel about that?
Raising my hand visually, I would say I would support that. We can always cancel it. Well, I have the floor. Just, Roberto, is there a possibility that the town could at least, in this period of time, hire a part-time public health nurse, or borrow one from the hospital and somehow, we do contribute to the infectious disease nurse salary, so could we contribute to, and could we kind of think out of the box about this? Seems to me there's some way in the short period of time we could figure out how to get a public health nurse.
We can definitely advertise for one. We can look into if there. I'll have to talk to Brian in finance, and to see where we can shake some of this money out of. But we can definitely post it. But the issue is we have to make sure people apply. Somebody who's capable has to be able to apply for it too. We can't just have a nurse available and then get our Medicare and Medicaid numbers up and running within a few weeks.
Can't we again have some relationship with the hospital, like the infectious and control nurse?
Absolutely.
Works for both of us. So why can't some nurse at the hospital work for both the town and the hospital?
We do. Actually, I work with Elizabeth Harris very closely.
Yeah.
She's actually doing all of our contact tracing for all of these cases. And she handles all of our direct observation therapies and anything like that. Luckily on Nantucket, we don't have a lot of DOTs. But if this were other towns, yes, we would have a lot. So yeah, Elizabeth Harris handles all of that for us right now. And we do pay for a significant portion of that salary.
That's what I was saying.
It wasn't that long ago. Weren't we talking about getting a...
We were applying to get it funded through the CHIP grants when those were available. And as far as but we just don't have infrastructure in place for it.
All right, does any other concerns or? So, go ahead, Melissa.
I was just going to say, so would we agree that I'm not clear on the date, but whatever 2 weeks from today is, that we would schedule a placeholder meeting so that would be September. Well, I would actually think September. Oh, I guess it's right. Our next meeting is right after that. I was thinking September 3rd, but that's before Labor Day weekend, actually. Maybe we just schedule it for then, and if we don't need it, we don't need it. At 3:00.
That's fine.
I'm all right with that.
So what's the date? September what? Sorry.
I think it's September 3rd is 2 weeks.
Okay.
It's right in the middle. And our next meeting would be September 17th,
Okay.
which is actually after the first day of school.
Okay, we'll do. I will get in contact with NCTV and Erica to make sure that time slot is definitely available.
Okay, thank you.
Thanks. Anything else?
Roberto?
Yes, sir.
Go ahead, Jim.
Could you give us a quick update on what's going on with the wells on the other side of the runway?
I'm not that much into that conversation right now. That, as far as I know, when you say the other side of the runway, you mean on the east side on Mattoxan Valley?
Yep.
To my knowledge, some of those houses were tested, and I believe some came back above the threshold, and most came back below. As far as the side on the west side, on the west sides of
The west side was recently tested.
Yeah, the west side was just recently tested, and I believe 2 houses came back positive for PFAS or PFAS.
More than that came back positive. I live there.
Okay.
And only 1 came back above the threshold. But really, I think if that's your home, it's a big deal. So anyone testing above 0, I think, is a big deal and probably should be getting the filtration systems. But
it's definitely true that anyone above 0 should pay attention. But unfortunately, what we're finding is that some of these houses that came back positive are meeting the same background numbers that most other septic systems are testing positive in. So what they're trying to find now is a source for that. Because it's PFAS, and PFAS is so ubiquitous that over 90% of everyone tested came back positive for it in their bloodstream. So they're trying to find out what the source contamination is, what the background level of contamination is. But as far as anything more than that, I honestly don't know.
Okay, thanks. Anybody else?
I'll make a motion to adjourn.
Okay. Can I get a second?
Second.
All in favor by roll call vote? Melissa Murphy?
Aye.
Meredith Lepre?
Aye.
James Cooper?
Aye.
Malcolm McNabb?
Yes, I.
And Chairman says yes. Okay, thanks everybody for
Very much.
Thank you.
seeing you guys. Thanks.
Thank you.